So today I'm gonna be covering pericarditis, and we're gonna cover three things today. So we're gonna cover acute pericarditis, chronic pericarditis, and pericardial effusion. So let's start off with acute pericarditis. What is actually pericarditis, right? Pericarditis is basically any sort of injury or inflammation or trauma to the pericardium, and the pericardium is the outer layer of the heart. So now let's look at acute pericarditis. We know that acute means small. So pericarditis for a small short duration is just acute pericarditis. Very simple. So what's gonna happen here is you're gonna get an inflammation of the pericarditis. It could be viral, it could be an infection, it could be trauma like an MI, it could be even rheumatoid arthritis, when your body goes crazy and then it starts attacking your own cells. So in this case, let's talk about the clinical manifestation. So you're going to see fever. When you get an infection, what are you going to get? You're going to get a fever. And now you're going to get myalgia. So you're going to get muscle ache, you feel fatigued, you feel tired, you feel dizzy, you feel all that. And then you're going to have malaise. So malaise is essentially just discomfort. You don't feel really well. All that happens when you're sick. Think of it the same way when you're talking about acute pericarditis. And the most important thing about acute pericarditis is that you're gonna get a sudden onset of chest pain. Cause think about it. Your heart is inflamed right now, and there's a lack of oxygen moving to your muscles because your heart's inflamed. So now what's gonna happen is, because of that lack of oxygen, you're going to feel weak. You're going to feel the chest pain in wherever the heart is. So that's acute pericarditis. So how would you treat them? So you would give them NSAIDs, you would give them anti-inflammatory medications, you would give them salicylates, but the most important one of them all is colchicine. Colchicine is going to help with that inflammation and that pain, and it's going to help relieve the patient, especially if it's acute. So now let's talk about chronic, also called constrictive pericarditis. So in this case, essentially chronic pericarditis is just pericarditis that's just built over time. So what's going to happen is it's going to have inflammation, and it's also going to have calcification. So what happens in your body when you get any kind of injury or inflammation is your body's like, yo, let me send out inflammatory cytokines to this area and you're gonna be fine. But even though it works for a little bit, in the long run, you're gonna have calcification. So it's going to kind of build on in the heart, and now the heart's just encased in a hard, closed shell. And now what's gonna happen? You're not gonna be able to pump blood. Think about, let me show you. Think about this. This is our heart right now. Okay? And now this is my inflammatory cytokines. I'm just covering it. How is it gonna pump any kind of blood? There's going to be low cardiac output. And if there's low cardiac output, what is that gonna give you? Low oxygen. So think about the clinical symptoms. The clinical symptoms are going to be shortness of breath, not being able to exercise properly, weakness, fatigue, all of that. They all come because of that enclosed shell. And what are your treatments? You're going to give them diuretics. You want to decrease the sodium and the fluid retention that's happening in the body. So you're going to give them diuretics, and you're also going to have them on a sodium restriction diet. So whatever they're eating, kind of lower the sodium, lower the salt, buddy. Okay? And obviously rest up, take care of yourself, do all that, anti-inflammatory medicines. And over time, if it doesn't work, you're going to probably have to get a surgery because at that point, your heart's just not functioning because you've given them all the non-invasive medications first. So that's chronic pericarditis. And now let's move into pericardial effusion. So your heart, or the pericardium layer, because that's the only thing we're talking about today, is made up of two specific layers called the serous layers, and in between the layers they have a pericardial cavity, and this cavity has serous fluid, it has pericardial fluid in it. And what this fluid essentially does is it helps with frictionless movement of the heart. So your heart contracting and relaxing, contracting and relaxing, it happens because of that fluid. And it also helps with like shock absorption. So if you know infections were to come, it would try its very best to kind of prevent that. So it's very useful. But there are cases where pericardial effusion, which is essentially just an accumulation of fluid that can happen in that pericardial cavity, and now what's going to happen is your heart is not going to be able to pump enough blood because this part's inflamed. This is the heart. It's not going to pump enough blood. So now you're going to have something called tamponade. And tamponade is just increased pressure. That's literally what the word is, increased pressure. So it increases the pressure of the heart, and now you're going to have left-sided heart failure, and now it's going to back up. It's going to back up and go in reverse because it's not going out of the body, so but it needs to leave somehow, so it's going to go backwards. So now it's going to follow the line of the lungs. It's going to go in the lungs, and that's why your clinical manifestations, one of them is shortness of breath because it's congested out here. And then it's going to go back up into the right side, and you're going to have right-sided heart failure, and then it's going to go into the body. But this is deoxygenated blood. We don't need deoxygenated blood, we need oxygenated blood. So that's what's going to happen, and you're going to get JVD, which is this vein right here. It's going to be inflamed, it's going to look really thick, and you're going to have edema, and you're going to have a bunch of other stuff. So shortness of breath, hypotension, edema, and JVD or jugular vein distension are the main ones, and what you would probably see in pericardial effusion. And always remember, pericardial effusion does not happen on its own. It always happens with either acute or chronic pericarditis. So there's inflammation that's going on, or some sort of bacteria that's going on for pericardial effusion to happen or to increase in pressure. But that is the pericardium for you.